Imagine this. You're home alone. The house is quiet. Suddenly, a strange pressure creeps across your chest. You feel dizzy. Maybe it's indigestion. But then your left arm tingles, your breathing tightens, and a terrifying truth hits you. You're having a heart attack, and no one is around to help. Every 40 seconds, someone in the world suffers a heart attack. For seniors over 60, especially those living alone, the outcome is often fatal. Not because help wasn't available, but because they didn't know what to do in those first 5 minutes. Let me be clear, this video could literally save your life or the life of someone you love. Because today we're revealing 7 expert-approved, life-saving steps you must take if a heart attack strikes when you're alone. Each one simple, powerful, and time-tested. And here's the most important part. Tip number 7 might be something you've heard before, but what we uncover about it will change how you see it forever. So I urge you, watch this video until the end. Your life could depend on it. Let's begin. Know the silent signs. When most people think of a heart attack, they picture a sudden, crushing chest pain, the kind you see in movies. But for seniors, the warning signs can be far more subtle and dangerously easy to ignore. You might feel a dull ache in your jaw. Maybe your upper back or neck feels stiff for no reason, or perhaps you're just a little more tired than usual. Lightheaded, maybe a little nauseous. Not enough to sound the alarm, but enough to feel off. Here's the scary truth. Older adults, especially women, often don't feel the classic chest pain at all. Instead, they experience what doctors call silent symptoms, like unusual sweating, shortness of breath, fatigue, or even what feels like indigestion. Why does this happen? As we age, our nervous system becomes less responsive. That means pain signals may be weaker or misdirected. Add to that decades of pushing through discomfort, and it's no wonder so many seniors mistake early heart attack signs for something minor. But time is everything. The sooner you recognize what's happening, the more likely you are to survive. If your body suddenly feels off in a way you can't explain, stop everything and pay attention. Because as we'll see in the next section, what you do in the first 60 seconds after recognizing these signs could save your life. Rule number 1, call for help immediately. When it comes to surviving a heart attack alone, there's one golden rule that stands above all others. Call emergency services immediately. Not in 5 minutes. Not after a cup of water. Not after you wait and see. Right now. Too many seniors hesitate. They're unsure if it's really a heart attack. They don't want to bother anyone or make a fuss. But hesitation kills. Every second that passes, your heart is losing oxygen. And without fast action, the damage could become permanent or fatal. Here's what the experts say: even if you're not sure, call. It's always better to let professionals rule it out than to gamble with your life. And don't call your daughter or neighbor first. They can't bring a defibrillator. They can't administer clot-busting meds. But paramedics can, and the faster they arrive, the better your chances. In fact, you should consider this right now. Put the emergency number on speed dial. If you live alone, keep your phone close at all times. Some even suggest using a medical alert system that calls for help with one touch. Because once help is on the way, you've already won half the battle. If you're still watching this video and finding these insights valuable, and if you haven't subscribed yet, I highly recommend you do it now. Tap that subscribe button and turn on the bell so you don't miss future videos like this. Your support helps us continue creating content that informs and protects seniors just like you. But let's say you've called for help. Now comes the part where most people panic, and that can be just as dangerous. So in the next section, we'll show you the one common pill in your cabinet that could slow down the heart attack before help arrives. Chew an aspirin, but not just any kind. You've called for help. Now what? There's a small, everyday item that could buy you precious time, and it's probably sitting in your medicine cabinet right now. It's aspirin, but not just any kind. Medical experts agree that chewing one 325 milligram regular aspirin or two 81 milligram baby aspirins can help slow the clotting process during a heart attack. This gives your heart a fighting chance while emergency help is on the way. But here's the critical part. You need to chew it, not swallow it. Why? Because chewing allows the aspirin to enter your bloodstream faster, where it can begin thinning your blood and reducing the size of the clot that's blocking blood flow to your heart. Do not use enteric-coated, delayed-release aspirin. Those are designed to dissolve in the intestines, not the stomach, and they won't work quickly enough in an emergency. Also, don't wait to take it until someone confirms it's a heart attack. If you feel the warning signs we talked about earlier, especially pressure in your chest, dizziness, or nausea, take it as soon as you've called emergency services. But don't overdo it. One standard dose is enough. Too much can increase the risk of internal bleeding, especially in older adults. This small step might seem too simple, but when it comes to surviving a heart attack alone, simple can be life-saving. And now that your heart's getting the help it needs, the next step is just as crucial. Because the way you position your body in the minutes before help arrives could mean the difference between survival or collapse. Let's move on to what to do physically while you wait, and why panic is the enemy. Control your breathing and sit upright. Your instincts might tell you to lie down and rest. After all, you're scared, you're in pain, and your body is screaming for relief. But when it comes to surviving a heart attack alone, what you do with your body while waiting can make a critical difference. Here's what cardiologists recommend. Sit upright in a stable position. Ideally, sit on a sturdy chair or couch with your back supported and your feet flat on the floor. This helps reduce pressure on the heart and makes it easier for your lungs to take in oxygen. Now, focus on your breathing. When fear kicks in, your breathing gets fast and shallow, but this only increases the strain on your heart. Instead, take slow, deep breaths through your nose and out through your mouth. Calm, steady breathing helps lower your heart rate and oxygenate your body more effectively. And here's something many people overlook. Don't try to walk around. Any unnecessary movement can put further stress on your heart. Stay as still and calm as possible. Let the aspirin and your emergency call do the heavy lifting while you focus on one thing: staying steady. It's normal to feel panic, but panic is your real enemy now. Fear floods your body with adrenaline, which can worsen the attack. But by staying upright and breathing intentionally, you're giving yourself the best possible chance at survival. Yellow circle with a dot in the middle. Still watching? If you're finding these tips helpful and haven't subscribed yet, please do. Hit that subscribe button and turn on notifications. Your support keeps this channel alive and helps us bring life-saving content to more people who need it. In the next section, we'll cover something few people think about in a crisis, yet it could save the paramedics critical minutes and give you a better chance at making it through alive. Let's talk about how a simple action like unlocking your front door could be the smartest move you make. Unlock your front door and grab ID. You're sitting upright, you're breathing slowly, and you've taken aspirin. Help is on the way. But there's one more move that could make the difference between life and death. And it's not about your body, it's about your door. In a heart attack, every second counts. If paramedics arrive and can't get inside your home, they'll be forced to break down the door. That costs precious time your heart doesn't have. If you can safely do so without collapsing or straining yourself. Unlock your front door. Just that one step can shave off minutes and ensure help reaches you immediately. And while you're at it, if you're able to move without risk, grab your ID, medical list, and emergency contact info. Keep them near the door or in an obvious place. This helps first responders understand what medications you take, if you have conditions like diabetes or blood pressure issues, or if there are allergies they need to know about. Better yet, create a small emergency folder. Label it clearly. Include a copy of your ID, a list of medications, allergies and medical conditions, emergency contact numbers. Pro tip: attach it to the back of your front door or keep it in a pouch on the fridge. EMTs are trained to look in these places. And if you live alone, consider a smart lock with remote access or a key safe outside your door. Paramedics often contact dispatch to retrieve the code if needed. It's more common than you think. These may sound like small things, but in the middle of a crisis, they become lifelines. Next, we're going to talk about a tip that's gone viral over the years, something called cough CPR. You may have seen people say it can restart your heart or keep it beating during an attack, but is that really true? or could it be dangerously misleading? The truth about cough CPR. You've probably heard the dramatic advice: if you're having a heart attack, just cough repeatedly and it will keep your heart beating. This idea, known as cough CPR, has circulated online for years and even made it into some emergency training myths. But here's the shocking truth. Cough CPR is not a reliable method to survive a heart attack alone. Medical experts warn that while coughing might temporarily stabilize your heartbeat in very specific, controlled situations, it's not a substitute for calling emergency services or getting professional help. The chances that coughing alone will restart or maintain your heart's function during a full-blown heart attack are extremely slim. More importantly, focusing on coughing can distract you from the most critical steps, like calling 911, taking aspirin, and staying calm. Cough CPR was originally intended as a maneuver for certain types of arrhythmias under direct medical supervision, not as a do-it-yourself survival tactic. So if you feel yourself having a heart attack, don't waste time trying to hack your heartbeat with coughing. Instead, follow the proven steps. Call for help, chew aspirin, sit upright, and breathe slowly. Remember, the best defense is quick action, not myths or shortcuts. The next tip might surprise you and goes against what many believe, especially seniors who think they can just drive themselves to the hospital. Don't drive yourself, even if you think you can. When a heart attack strikes, your first instinct might be to get behind the wheel and drive yourself to the hospital. You might think you know the fastest way or don't want to bother anyone for help. But this is one of the most dangerous choices you can make. Driving yourself during a heart distress situation is extremely risky. You could suddenly lose consciousness without warning, or worse, cause an accident that endangers you and others. Calling emergency services isn't just about getting a ride. It means trained professionals come to you with the right equipment and medications to start life-saving treatment right away. They can provide oxygen, monitor your heart, and perform critical interventions on the spot or en route to the hospital. Even if you feel okay for now, heart attacks can escalate quickly and unpredictably. Stay where you are and wait for emergency help to arrive. It's a tough thing to do when you're scared and alone, but it greatly improves your chance of survival. Now that you know these 7 expert tips, it's time to take control. Write them down. Share this video with a loved one, because preparation is the key to survival. Surviving a heart attack alone after 60 isn't just about luck, it's about knowledge and swift action. Today you've learned the silent signs to watch for, why calling for help immediately is critical, how aspirin and your body position can save your heart, the importance of unlocking your door, and why myths like cough CPR won't save you. And most importantly, never drive yourself. Let the experts come to you. Remember, being prepared isn't fear, it's power. Thank you for watching. If this video could help you or someone you love, please subscribe and click the bell icon so you don't miss life-saving tips in the future. Your support means everything to us and helps us keep creating content that informs and protects. Stay safe, stay informed, and we'll see you in the next video.